What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering the X-ray protocol for when a patient gets intubated. So, for those who do not know, I am a night shift X-ray tech. I've been doing it for 4 years. Work a lot of overtime, so dabble in those. So, essentially, when a patient gets intubated because they can't breathe, usually, most of the time, I'll see it either happen in ICU or, well, it can't happen in any floor, but usually it's in the ER and then ICU. It's kind of the two big ones. They'll get intubated, so essentially the doctor or whoever, or respiratory, will kind of lead the pipes, the breathing pipes down them. And usually you shoot a standard chest x-ray. And then depending if they put an OG tube or NG tube, depending on the patient, you'll get one for placement of that. That's standard protocol for our hospital. And depending on the severity of the patient, depending on what's going on, usually the chest x-ray will be fine. They'll look for the placement of like where they put the tube. So if there's a doctor or respiratory, they'll kind of look at it, or they'll try to find a doctor to see, like, hey, is this in place? Can we use it? Is it okay? And they might adjust a few centimeters here or there for that one. And then for the OG tube, once again, that one too, the doctor will look at it and be like, hey, we need to shoot again, or hey, we'll just move it. We don't have to shoot again. That's kind of the standard protocol. That nothing really hard. Usually the patient will be like passed out because they've gave him propofol, which is a medicine to put him to sleep. So the patient is kind of like dead weight. So you either try to push it yourself or have them roll over to place the board. But it's pretty standard protocol. Nothing too crazy. It's within the norm of, especially if you work in the emergency room like I do, you'll see it all the time. And depending on the patients, their anatomy will kind of throw off like the nurses or some of the doctors on how they place stuff. Usually what I've seen in the emergency room, they do pretty good at getting the placement pretty well. It's when they get intubated on the other floors around the hospital that those nurses, I guess, they know how to do it, but they don't do it as much as the emergency room and some of the ICU places. So like maybe they will have to adjust more and you'll have to shoot more KUBs or more chest x-rays compared to like other departments of the hospital. Yeah, it's been your boy Miguel. See you on the next one.